Okay.
Yes, sir, we can start.
Balaji. All right. Thanks, Kanan. Balaji, you can go ahead. Maybe you can just introduce yourself and go ahead with it.
Yeah, yeah. Let me share my screen.
Sure.
Just a minute. Okay.
Balaji, you are on parental today? Yeah.
Yeah, yeah,
So,
Thank you.
yeah, yeah. So, is my screen visible?
it's slowly opening, Balaji. Yeah.
Okay, okay.
Okay, Balaji. Go for it.
Okay, okay. So, good morning, and first of all, thank you all, for this opportunity. And I also need to thank all the coordinators and the organizers and even the students for this effort, because it's not an easy joke to be done consecutively every other week or every other month. So it's a great initiative, and thank you all for this. So let me quickly jump into the session and a brief about me. So myself, Balaji Panneerselvam, and I'm basically from Chennai, and I did my education up to schooling in my Chennai, and had my B.Pharm done in Varanasi, and then had my M.Pharm in Madurai Medical College, and had started my career with a organization called Yandan Silak, a subsidiary of Johnson Johnson. And then eventually, when I was in Madurai, I was also working with an organization called Antna Nutritech, which taught me a lot in managing many things, and that was kind of an eye opener for me in many aspects. And then after my postgraduate, I joined an organization called Hospira, which was basically in parental drug product development. I'm into the R&D part of this parental drug product manufacturing. And then this organization was taken over by Pfizer since last year. So it is almost 12 years of career now in parental drug development as well as in manufacturing. And I'm kind of a person who travels a lot, meet many people, and I have a kid. She's just 7 years old. Yeah, that's all about me. Just coming to the parental. Uh, Maybe I would like to understand from the group, like since since I just got a chance to interact very minimally. So what is that you're looking for from the parental? Is that the development part, or is that the basic understanding of the manufacturing, or how the approval for a product goes, like, so that I'll try to take you in that particular direction, and you can take maximum amount of information from that. Any thoughts
Uh,
on this? Yeah.
Balaji, just to give you an update, all these students who are attending are preparing for GPAT.
Okay. Yeah.
So on the perspective, if you can help them, yes, it will be better. So you can just give them an idea what could be the questions or whatever.
Sure. Sure.
Any
And
parenterals and general formulation development with other aspects if you are interested in. Because most of them are M.Pharm freshers. I mean, B.Pharm and some
M.Pharm.
are already in the field. So it will be extremely useful. Thank you, Balaji.
Okay. So I'll try to keep it simple. I'll give a overview of what parental is, and then how the parental drug is being manufactured, and finally I'll touch upon what are the things needs to be considered for development. Hope that will be of good coverage of all. And to be honest with
Sure.
you all, each of this single word you can talk for a day, or I would say like more than days about these. But since given a time is just 1 hour, I'll try to make much out of it. And one final thing before I go into session, or should we go with Tamil as well, or is there any other language people are
We,
interested in?
we can go with a mix of Tamil and English, Balaji. That should be okay.
Mix of Tamil and English. That's okay. Okay, fine. Let's go into the session now. So thank you all again. So coming back to the parental drug products, to keep it simple, any drug product which are being administered other than enteral, which means other than oral, other than topical, we call them as para-enteral. So one thing about this is like whatever the drug administered through intravenous route of parenteral, which directly goes into the blood circulation, that's that will not go into the first pass metabolism. So that's the difference between the normal route and the parenteral route. And coming to the parenteral, based upon the administration, can be broadly classified as intramuscular, subcutaneous, intravenous, or intradermal. So it all basically depends upon in which part of the body, in terms of our skin and the muscle, where the drug is being delivered. So it's based upon the administration methodology. It has been broadly classified into 4. So hope you'll be able to visualize this from this picture. Just a brief history. The history goes back some 360 years. The first product was administered into a dog. It was, when it was tested, it was the opium administered in dog. And then in human, it was in 1660. But the patient died because of microbial contamination, and then gradually, or I would say late after, 1796, the next drug product was, tested by Edward Jenner. So and then the, development goes on. So coming to this parental drug product, the actual or the real parental drug product manufacture development would have started in, late 1880s, from where they were, understood the requirements of what a parental product should be like, how safely a parental product can be administered. So there, they had thought about like what is the best way to, administer the parental drug product in a safe and sterile manner. Just, whenever you come across any parental drug product, keep in mind sterility will always come along with that. You cannot have a parental product without sterility. So sterility and parental, are like twins. So there are many techniques for sterilization. The broadly or widely used technique in parental, even mainly autoclave, or I would say like thermal sterilization. So which is a sterilization by moist heat. Hope even the final students or the masters, you would have done some autoclaving studies in your labs, or at least you would have seen something. Team, did I lost you, or you're able to hear me? I don't know. Like since I'm the one talking, I couldn't judge.
Yes, sir.
Hello. Okay. Thank you. And what I'll do is I'll try to finish off the session maybe in 50 minutes, and I'll reserve 5 to 10 minutes for a discussion so that you can check with me for any information on this. Thank you.
Sure, please.
So yeah. So why a drug product should be administered by a parental method? Like why not only oral? Because parental always seems to be a pain causing one, and it needs some intervention into the body. So why that should be administered by parental and why not by other routes? Maybe by an ointment or by a tablet or a capsule or something which is an easy method, right? The reasons are like some of the drug products needs to be administered immediately to get an immediate effect. Sometimes the patient's condition may be seriously ill, and he'll not be able to consume the tablet in a condition where the patient is in a comatose stage, or if the patient is unconscious, or if the patient is not able to swallow something. So that is one main reason. And second reason is sometimes when we want to have an immediate effect, because things like a sudden collapse, a sudden heart attack, or a sudden or I would say like
Emergency.
obstructive illness, emergency. Yes, emergency, right word, like obstructive illness, where the patient needs an immediate response so that they can be brought to a stable. So that's the most important reason the parental drug products are significant. And take it from me, like many of the medications that are used in ICUs, intensive care units, or the emergency treatment area, all those or most of those, I would say, would fall under parental category. Okay, so these are the main reasons why the parental drugs are important. And the parenteral drugs needs to be sterile as well. As I said, the sterility and parenteral are twins. Why it needs to be sterile?
It should be.
Any thoughts on that?
It is direct contact with blood, sir. So it should be highly sterile.
Okay. Great.
If
What?
somebody is
Any
answering
other?
the question, Balaji, 1 minute.
Be
If
free
somebody is
from-
answering, please introduce yourself before you answer the questions.
Yeah.
It should be
Okay.
free from microorganisms.
So why? Because we have, even when we, live as such in our environment, as well as in our body, we have microorganisms. But why then it should be free from microorganisms? Okay. I'll, I'll not go into more of that kind of discussion. Your answers are correct. You're perfect. Like, since the drug product is being, injected into the body, it crosses many protective mechanism and barriers, like whatever the mechanism we have over the skin, or whatever the protective mechanisms we have in the mouth or in the digestive system. All these barriers are being bypassed. So it can directly go in contact with the blood, as one of team members said. Once it is in direct contact with the blood, if the drug product has got some microorganisms or microbial growth agents, it might serve as a base or a media for many microorganisms to grow, and it multiplies them into different colonies, and then this in turn might might cause illness to the patient rather than protecting a patient. So that is one of the reasons it should be completely sterile. When we say it should be completely sterile, to say it's a single word, it can be easy to say it's a sterile, but to manufacture this as a sterile product is a cumbersome task. I would say it's an Himalayan task. I'll take you through that, in the next slides. One has to take a greater effort in manufacturing a parenteral drug product than solid oral or a liquid oral product. Okay. So coming back to the sterility, importance of sterility. So it should be free from the parenteral product should be free from any of the physical or chemical or biological contaminants. When we say about physical, chemical, or biological contaminants, the biological contaminants are kind of microorganisms that might be in the product if the product is not sterile. And the second thing is, it should not be mixed with any other chemicals that is not intended to be there in the product. For example, when we make a product, there are many unit operations we do, like mixing, we do filtration, filling, and then finally packing. So in any of this process, if any of the chemical being introduced by inadvertent mistake, or I would say, like, if the packaging material leaches or introduce some of the chemicals, right? Or you would say, like, if any of the manufacturing components leaches or any chemicals, that might in turn become harmful to the product. Just a question to the team, like, when do you think the reactions between the chemicals will be more? Is it in a solid state, gaseous states, or in a liquid state?
Liquid state, sir.
Yeah, great answer. Thank you. Like, so since the injectables are mostly in a liquid form, and if we have any chemical that was not intended for a product, if that is there in the drug product, the chances are that it might give a untoward reaction. There will be some chemical reaction. It might form some impurities, and that impurities might be detrimental to the patient. So that is one of the reasons it should be free from chemical. Now coming to the physical, why the word physical is coming here? Physical contamination. What is that you think of a physical contamination?
Sir, particles, minute particles.
Okay. What will happen, like, if you have minute particles?
It may clog.
Great. It might clog the blood vessels, or it might trigger some reactions inside the body as these particles are getting into the blood vessels, and it might give some hypersensitive reactions, which will lead into highly detrimental effect to the patient. Great. I think maybe Malakandan sir and others, the team is knowledgeable in parental that. I'm not sure why. Maybe if the team needs a session or not. But great to know that the team is having some good understanding. So the other piece, important one, is it should be free of pyrogens. And can anyone tell me, like, what do you understand pyrogens?
Fever inducing substance, sir.
Great. It's a fear-inducing substance, and that comes from the bacteria. I mean, any thoughts on which type of bacteria you may get this one?
Sir, gram-positive bacteria.
Great. So I think you guys have really good understanding on this. So in 1923, it was one one scientist called Flores and Sebert, and she identified a pyrogenic reaction, and they identified that in case of this microbial contamination, uh, there could be some detrimental effect to the patient. So coming to the characteristics of a parenteral product, what a parenteral product should be like, a parenteral product should be safe, which means, since it is being bypassing all the, preventive barriers in the body, it should be safe enough. It should be free from endotoxins. It should be free from particles. It should be free from any chemical contamination. And more importantly, the packaging material or other things which we use, it should be much compatible with this product. So normally you would have seen in hospital setups, sometimes you can see that the nursing staff may inject some a little volume of injection into a larger volume of injectable. Have you seen such thing like that?
Trips, sir. Electrolytes.
Trips in IV trips, sir. Yeah, in IV trip, for example, 0.9% NaCl or 5% dextrose. There could be some vitamin injections they used to put. So basically, parenteral drug products are being administered when the patient is hospitalized mostly. And then in hospital setups, you will not be able to do a multiple puncture to the patient, right? You cannot say if you want to administer, 6 tablets or 6 or 7 types of medication, you will not be able to do a 6 or 7 puncture in a patient, right? So in that conditions, there is a need or a requirement, I would say, like a concomitant administration or a combination of drugs to be administered to a patient. So in that sense, the parenteral drug products need to be compatible as well. So what people used to do is, there is another part of research people used to conduct. Okay, what are the type of medications the hospital setup is administering the patient? So if what is the difficulty they face? If they feel that, or if they believe that 2 or 3 of drug product cannot be combined together, and if that has to be administered separately, and if that is giving some difficulties, they come to the lab back again and try to make a formula which helps them to co-administer, right? A parenteral drug, as you said, like, it should be free from particles. The particles should not be, and even for 10 micron, there is a limit. It should be less than, say, I think around particles of say 10 micron and how much particles of 25 micron is allowed in a parenteral drug product based upon the volume. But no visible particle to be administered hypersensitive reactions and clogging of the minor blood. And coming to the uh, sterility part, when we say parenteral product sterility, it doesn't mean the sterility of the final product alone. When we say sterility of a final product is like, say I take some drug and I take some excipients and I take some vehicle, I mix them and then fill them and finally sterilize. Now that is not the only methodology to ensure sterility. It comes from making the entire process under aseptic condition. For example, what are the materials to check what is the bioburden or how much is the microbial limit in that particular material, what are the raw material we use. And then when we bring in the water, so what is the microbial control we have in the water. And then the mixing area, the processing area, how much of control we have in the processing area. So all these things are monitored before we make this uh, drug product. So guys, any questions on this before I move on to next slide? Anything you would like to specifically check or discuss on this? Okay, and the characteristics of a parental product, it's an universal one. So if it is in US or if it is in India or if it is in anywhere in the world, these are the basic characteristics a parental drug product should have. Okay. Okay. Now coming to the injectables types. So the injectable types based upon the volume that can be broadly classified under small volume injectable and large volumes. So when we have a product less than 100 ml, we call them as small volume injectables. When it is more than 100 ml, we call them as large volume injectables. And again, based upon the type of formulations, you have many things like say dry powder injectable, where the vial will have only powder, and also lifeless drug product, where in the vial you can just see kind of a white cake, and the powder will be lyophilized. And then there is another type of product called liquid injectable, where you will have liquid, and even in liquid injectable you have the aqueous and non-aqueous. Mostly non-aqueous, it will be oil based. And even in the liquid injectable, there are things like suspension based formulation and emulsion based formulations. So the critical piece in suspension formulation is mostly the suspension formulation will not be administered by intravenous route for some of the information we just discussed just now. So because of the particle size limitation, the suspension product are mostly not administered by IV route, but there are suspension product administered by intramuscular and subcutaneous routes. Similarly, to the emulsions, but with the emulsion, if the globule size are very minimal, they can still be administered by intravenous route. But this will not be administered as a concentrated solution. It will be administered as a dilute solution, so that the patient will not get a more concentrated globules in a particular site. So again, beyond these type of formulations, based upon the packaging material, the products come in like vial with rubber stopper and seals and ampules, and there are pre-filled cartridges available, and also bags. You would have seen like this diluent bags, say sodium chloride or dextrose with sodium chloride. So these drug product comes in bags, whereas there are some drug products which come in plastic vials as well. Nowadays, if you see, mostly the ampules are being avoided, and mostly they're transferring to vial and vial based upon rubber stopper and seals type. And an additional step nowadays, it is still advanced. Like people are trying to change to pre-fill syringes for many products, so that that can be just opened up and directly injected without any further reconstitution or something. Coming to the lifeless product, it's a very important or interesting drug product, I would say, where I love making lifeless drug products, because this technique needs a good amount of scientific rigor for one to develop a cycle and develop a good quality product. It needs at least, I would say like 2 years for anybody to develop a great cycle, to a manufacturing scale, starting from the lab to manufacture. So this is in short about the type of parental products. Any questions or anything you would like to have specifically on this, which will be helpful to you in the examination front? Please let me know. I'll be happy to answer, if at all I know the answer. Okay. One more thing, people should be cautious about this vial product, which is a glass product is. As we discussed in our previous slide, the product should be free from physical, chemical, and biological contamination. The glass material has got a role where it can create a physical contamination. So though the glass are kind of inert material, sometimes upon storage, they may uh, undergo a process called glass delamination, by which the glass particles or glass flakes may come into your product. And most of them are kind of it will not be visible through naked eyes sometimes, because again glass itself is it's a colorless one, and again the particle will be very small. So it becomes very difficult for someone to identify if there is a physical contamination in the product or not. So that's a serious concern, worked on in many of the products. So selecting a glass itself is a important piece of this product development. So coming to the types of package, so the drug product or packaging are categorized into primary, secondary, tertiary. Okay, so those components which come in direct contact. Hello, did I lost you?
Yes, sir.
Yeah, Balaji, we can hear you.
Hello.
Please go ahead.
We can. Oh, okay, fine. Sorry, it seems my internet is not stable. Okay, great.
There is
So,
a bit of a lag on your
these.
voice. Otherwise, it's okay.
Okay. So hope now this is fine now.
Yes, Balaji, it's fine now.
Okay, great. Thank you. So those components which come in direct contact with your product is called primary packaging. For example, the vial and the rubber stopper, which come in direct contact with your liquid injection, these two are called primary packaging. The one which comes on the top of the rubber stopper, which is a seal, you would have seen those seals and other outer plastic or the paper based or the cartons, they form a secondary packaging, and then these cotton are then put into a bigger cotton boxes. They form the tertiary packaging. There are cases the chemical combination has happened even from a secondary packaging. So if you remember, I said the packaging material, the primary packaging is from glass as well as plastic. Plastic being a semi-permeable container. And once there was an incident where the secondary packaging material was wet because of some contamination, like some water was spilled on that or something has happened during transport. And then what happened was the material, the ink which was there in the secondary carton, the secondary packaging, that ink the drug product, and that has caused a serious concern. So whenever we do a product, we develop a product, so the focus should not be only on the formulation aspect alone or the process aspect alone. There should be an utmost care, to be given when you are selecting or when you are, finalizing primary as well as secondary packaging material. And more importantly, there are studies being done even in transportation also. We used to do some studies called freeze-thaw studies, because the products travel from countries to countries. When the product travels through Europe, the product will undergo a temperature around -20 or -30, but actual storage condition for the product is 25 degrees Celsius. So who knows what's going to happen when the product is exposed to -20 degrees Celsius. So there'll be some studies will be done to see what happens to the product when it is being exposed to such extremities, both in positive as well as negative temperature. So these are some of the aspects one should think of when they are selecting a primary or secondary packaging or selecting a formulation or process. I'm just coming to the overview of the parenteral drug product manufacturing. Team, so far so good, or it's boring, or how do you feel like?
Sir, okay, sir. Okay, sir. Carry on, sir.
So, interesting, Balaji.
Carry on.
The students are listening, and thank you. It's very interesting.
Okay,
Please.
great. Fine.
Thank you.
Okay, great. Thank you. So, as we said, now we understood what are the types of a parenteral product, or what a parenteral product characteristics are, or what a parenteral product needs. And now, to meet these needs, what are the things one should do in the garage or in the shop floor to make sure that the product is coming as intended, right? Say, for example, if car, the car 4 wheels, 4 doors, and there should be a a dicky to open up, keep our luggages, and all the specifications will be there. But in case finally, if it turns out to be that the car wheel, one of the wheel, one among the 4 wheel is of a different size. Would that serve the purpose? It won't, right? So that's the important thing one should think of. So whenever we design and develop a product, first thing we need to make a profile called target product profile. What is your target product profile of a particular product? When I say a liquid injectable, it's say 10 ml. Okay, 10 ml should be the fill volume, and in the 10 ml, when I should be withdrawing from the syringe and needle, I should be able to withdraw 10 ml. Remember, you'll not be able to suck out every single drop of the nectar from the vial. So there'll be some amount of drug product will still be left in the vial. But what a patient need is a 10 ml. So you need to think of all these things, and then you need to decide, when I want to take a 10 ml, what should be the fill? Be something like 10.1 or 10.2, right? And at the same time, if I overfill the product with say more than say instead of 10 ml, if I fill with 11 ml, the nursing staff who is withdrawing the content from the syringe may really just not focus on withdrawing 10 ml alone. And second thing, the disposable syringes or the syringes what they have in the market, they are not finely calibrated with the markings. The markings are just for an information purpose. They are not graduated or they are not calibrated for that volume. So in that sense, if you fill with a higher volume, eventually patient is going to get a more dose than actually required, and that again may cause implications. So one should be very careful in deciding these things. So in a parenteral manufacturing, a formulator should think of what are the components he's adding in the formulation. I mean, you should be very careful about the formulation. You should be very careful about the process. When I say process, it includes the manufacturing process conditions, and then the process parameters. What parameters you should have, how much is the fill volume, okay, and what type of content closure you should select, and what type of stuff. All these things has to be thought thoroughly by a formulation scientist. Otherwise, you will make a bad product, put many of our lives into trouble, right? Okay. Um, so we got 25 minutes. So this is an overview of parenteral drug manufacturing. So normally in our in most of the parenteral products, you'll see water for injection as the vehicle. Mostly the parenteral products will have WFA as the vehicle, most of them, because since it is being injected into the body, it should be compatible with the body. And like especially with the IV drug products, with the blood, as such you cannot inject oil formulation directly. So mostly the products are like made with WFI. There could be some amount of other components, like there could be a little amount of alcohol or a little amount of oil, but the primary base would be WFI. So once the WFI is there, and it will be drawn into the vessel, and then you'll add the components into mixing, and then based upon the parameter set by the scientist as well as there in the batch record, the mixing process will undergo. And then once the mixing is done, there'll be a preliminary filtration. Then it will go to the holding vessel, and then from the holding vessel it will go into filling. And after filling, before filling, there'll be one more filtration step. And before filling, there'll be fill volume checks. And after filling, it will be stoppered and sealed. So the product which is stoppered and sealed, which is mostly only the primary container, that will go into sterilization. So the sterilization will be done with the primary packaging material, and then finally it will be packaged using cartons, small cartons, or based upon the secondary packaging material, it will be put in the cartons. This is just an overview or a figure of where exactly the filling operation takes place. So hope you remember, like we said, like the product should be sterile. So sterile, like no entry of microorganisms is permitted. So all the people who are working on will be wearing at least 2 or 3 gowns, and those gowns will be sterile and sterilized periodically, and they will not be able to work for more than 4 hours in the line. They will frequently change over. Okay. So the parenteral product manufacturing process includes compounding, which is mixing, and then filtration, then sterilization. So in case if some products are, cannot be terminally sterilized, hope you understand, like terminal sterilization involves temperature, right? What is the temperature generally used for terminal sterilization? Any thoughts on this? Any idea? temperature we use for thermal sterilization?
Sir, according 130 degrees Celsius. Sir. 30 degrees
121, 121.5 degrees centigrade, sir.
Yeah, 121 is the approximate or the right one. There are products which are being exposed to 130, but it's a bit rare, not for the drug products, but they do for other things like glass vessels or SS vessels or other components. But yeah, you got the right answers, both of you. So actually, it is not 121.5; it is 121.1. And there is a reason why exactly 121.1. So I'll not be able to go much into that, but I'll just give you a brief thing. At 121.1, you will be able to get a 1 log reduction of microorganism. There is a specific microorganism which is sorry,
Bacillus stereothermophilus bacteria.
great, Bacillus stereothermophilus. Great. So I think you guys need not have this session. You guys have a great understanding of this. So this Bacillus stereothermophilus, how this killing mechanism happen is, if the product is being or the product with the Bacillus stereothermophilus is being exposed, okay, at 121.1 degrees Celsius, when it is exposed to say 7 minutes, 7 to 8 minutes, this will give a 6 log reduction. When we say 6 log reduction, 1 million of these Bacillus stereothermophilus, 1 million count of these stereothermophilus, when exposed to 120.1 for 7 minutes, will get reduced to less than 1 number, which means actually, I mean, when we say less than 1, which is nothing, but actually they'll not count that as a 0 count. That's basically to make sure it's a statistical reason why they don't want to make to absolute 0. But just to give an example, this is why the thermal sterilization process is being fixed at this temperature. But to justify the other answer said by 130, yes, there are conditions to do at 130. The reason is, if at 121.1 for 7 minutes, whatever the heat input a particular drug product will get exposed to, that can be achieved at 130 within say 2 minutes time. So there is a process for this called F0, heat input. So the thermal sterilization cycle will be fixed based upon the heat input. And remember one more thing, the thermal killing of the microorganisms will also happen at 110 degrees as well. Okay. And for your information, the least temperature that can be deployed for a thermal sterilization is 115 degrees Celsius. And this is as per the European Medical Agency. Any temperature you expose less than 115 or any methodology you have with less than 115 cannot be called or claimed as a sterilization methodology or a thermal sterilization. So you should have a minimum of 115 degrees Celsius, and you can go maximum up to 130, even up to 132. So this is general overview of thermal sterilization. Okay, now a question: what if a product is not able to withstand this temperature? Say if a product is highly sensitive to temperature, even it cannot withstand say 50 degrees Celsius, how you would sterilize the product?
Sir, high pressure, high vacuum.
Okay, what high pressure and high vacuum will do?
It just create a negative pressure, sir.
Okay, how this negative pressure is going to kill the microorganism?
Sir, it absorbs all the microbes at this temperature, sir. So the bacteria cannot withstand at that temperature.
No, temperature is fine. My question is, when you don't have a temperature, I'm saying like the product cannot withstand 50 degrees Celsius. More than 50 degrees Celsius, the product will degrade, or it will be melting, or something will happen. Or just to give a little bit of clarity, your product is not a liquid injectable. Just imagine your product is a dry powder. Can you sterilize a dry powder?
Yes, sir.
Yes, sir, we can sterilize.
How do you do that?
Based on dry heat sterilization, sir.
No, dry heat. The moment the heat is there, the powder will melt. I mean, the solid will melt. Okay. Since we have less time, I'll just quickly jump onto the conclusion. Normally, the powders. Sorry.
So we go for gaseous sterilization, sir.
Yes, gaseous sterilization is one option, but again, even in the gaseous sterilization, the problem is it cannot, what to say, like, it cannot sterilize the actual powder. So what I'm trying to say is, when you heat normally in your thermal solution, the liquid injectable inside the vial is also will be heated, right? And because of that temperature, whatever the forms of life inside the liquid injectable is getting killed. So similarly, if you apply gaseous sterilization, there is no energy inside the powder. Okay, there is no heat energy there, so you cannot kill the microorganism. And again, whatever the gas you are applying, it will be there only in the primary container, right? And you will not be able to heat the or give an energy to the product inside the vial such that you can kill the microorganism, right? So the process generally followed for dry powders are aseptic processing, aseptic crystallization. So normally what they do is, the entire process what they do as part of a manufacture, that will be done under a complete aseptic area. And if at all the dry powder cannot be made, that can be made into another form called lyophilized drug product. In lyophilized drug product, what they'll do is
They'll supply the
aseptically, sorry.
in lyophilized product, they'll induce vacuum, sir, to remove the moisture.
Yeah, partially you're right, and it's a great thing. I'll just give you a brief of that. What happens in lyophilization? First, the drug product or the drug substance, along with the excipients, whatever the other components they want to have, that will be put into mixing vessel, and then it will be formed into a solution. And then this solution will be filled into the vials like this. What you're seeing in the picture, it will be filled like this. Once after this has been filled, these vials will travel, and all this process will happen under a aseptic condition. Aseptic condition means there is another slide, in next upcoming area. It's in a clean room where the area is classified as grade A area, where you can see less than 100 particles of say 1.1 micron size, less than 100 particles per cubic meter. Okay. Contained, it will be completely closed. The airflow will be positive inside the manufacturing line. No air from the external environment can enter. So the air quality will be conducted, and even human intervention will not be there. You are seeing this picture on the the second picture where the human is standing outside. The process, the manufacturing process is happening inside, right? Even the human cannot interfere. If at all he want to interfere, he can access the filling line with the glove ports. So that is the area where the aseptic processing happens. So it will be filled, and then these filled vials with a special type of rubber stoppers, it will be half seated. Normally, once you fill the vial, it will just stopper the rubber stopper, right? I mean, it will be full seated. For this lyophilized product, it will be half seated. There'll be some openings just between the the stopper and the vial, and these vials will go into a lyophilizer. It will be passed on into a lyophilizer. Inside the lyophilizer, it will be frozen to less than -40 or -50 degrees Celsius for say 3, 4, or 5 hours, depending upon the product requirement. And then the vacuum will be pulled down, right? The vacuum will be pulled to such a level that it will be, I don't know how to express this. The room temperature vacuum, or in the room pressure, is 1 atmospheric pressure what we live in. It is equivalent to 760,000 milliliter. Okay, just imagine this 7,60,000 milliliter, 200 to 300 milliliter. So that will be the vacuum inside the lyophilizer, and the drying will happen in that condition at sub-zero conditions. Means the drying will happen at -20 or -10 or even at -30 degrees Celsius under vacuum, and this process will take for 3 or 4 days. Okay, so that is how the lyophilized products will be done under aseptic conditions, so that those products which cannot be processed by thermal solution will be manufactured using lyophilized product or aseptic processing. So this is the overview of the rooms, like what it will be. The room should be very, very clean, and you cannot see a single piece of a dirt or a single piece of any particles or something like that. And people, whenever they are entering, when they come out from a normal dress, from a normal street dress, they should be wearing at least 2 or 3 different gowns before they enter inside the production area. And inside the production area, they'll be under a positive airflow. So the airflow will be a kind of a laminar airflow. There will be a positive pressure, so that no particles from outside or no microorganisms from outside can enter into the drug product manufacturing area. So this this kind of classification is called grade A or class 100 classification. All your filling operations will happen here. So this is an overview of the manufacturing process. I'll not dwell much into this. So whichever the components which are coming in, they'll be checked, tested for the quality control, be it a raw material, be it a glass component, be it an API. So there will be some set of specifications set for this, and this itself is it will take at least 6 months for a scientist to do this one. So based upon the specification, it will be tested. Manufacturing area, and there will be a batch record, and each product has got a batch record that will have details about how much quantity of metal should be weighed and how much quantity of metal should be added, and what will be the order of addition, which has to be added first and which has to be added next, and at what rate, and how much volume should be made. So all this information will be there in the batch record, and based upon that, the manufacturing process will happen. And as part of the manufacturing process, there'll be in-process controls, like in-process sampling will be taken. Like people will take samples to check whether the fill volume is right or not. And in case of a liquid injectable, if the product is pH sensitive, you need to maintain a product at a certain pH, right? Whether the pH is maintaining right or not. If there is a problem or if it goes out of specification in the pH, that cannot be used for next steps like filling or packaging. And then after the in-process tests are being done at QC, and then the product will be packaged and then labeled, and finally there'll be additional test, finished product test. We call them as finished product test. So till we get the finished product test done and certified that the product is good to go to the market, the product will not be sent out to the market. It will be just sitting in the warehouse. So this is the classification. You can just type on clean room standards in the Google and you can just get this information. So this grade A area is the area where we do all our filling operations. So grade A area is the one where you have, say less than 3,000 counts of 0.5 micron particles. Okay, and sorry, yeah. So just remember, like whenever your filling operation will happen under class 100 or grade A area, your component preparation can happen in grade B. Grade B component means like mixing can be done in grade B. Like you add all the excipients, chemicals in water and then mix, that will be there in the grade B area. That can be done in grade B because after mixing there will be a filtration. So when you filter, the solution will be free from all the particles. And even for filters, there are criteria are there. For a aseptic processing, the filter what they use is 0.2 micron rated filter, which is called a sterilizing grade filter. Just keep in mind 0.22 or 0.2 micron rated. You cannot call this as an absolute filter. It's not 0.22 micron absolute number. It's a rated. There is a reason for this. I'll not be able to cover that in this session now. Maybe we can have a separate session for that. It's a 0.2 micron rated filters, which are called as sterilizing grade filters. Those are the filters which can effectively remove a smallest form of microorganism called Brevantimonas diminuta. B. diminuta is the name of the organism, which is the least sized microorganism, which is around 0.1 to 0.15 micron. And that can be removed with the help of this sterilizing grade filters. So these are the barriers and isolators normally deployed in using in the manufacturing area. So these barriers and isolators have got dual work. One, to protect the product and to protect the operating person. Okay. Now coming to protect the product, since it is a classified area like class 100 and it's a class 100 and grade area, it can be an effective barrier for viable and non-viable particles to the product. Okay. And number two, some of the drug products which are cytotoxic in nature or oncology, I would say cancer drug products, exposure to that drug product will be detrimental to the people operating. So there is a protection from potent molecules by using these wraps. So these restricted area access barrier systems there are two types. One is active wraps and passive wraps. For active wraps, like you will have all the filters and everything all integrated within that particular isolator itself. Okay. If it is a passive wrap, the filters and other things, all the supplies and utilities will be attached to the facility. So that's the basic difference. But by and large, in principle, both are same and both will give you a required, the class 100 requirement. So water quality is another important piece one should maintain. So two things one should be of taking care is water quality and air quality. The water what they use in liquid injectable manufacturing or even lifeless product or whatever the type of operation they do in the injectable manufacturing is WFI. So for WFI, first the process the water to softener, and then they remove the carbon, decarbonization will take place, and then dechlorination. It will be passed on to UV, to get rid of these microorganisms to some extent, and then it will be passed on to the filters, and then it will undergo osmosis process. Finally, what are the water coming out? That will be maintained either in a storage tank at 80 degrees Celsius, or it will be in a circulating loop. So whatever the water coming to each manufacturing segments, there will not be dead spots in that. It will be in a circulating loop. Why there will not be dead spots is, if at all some microorganisms are there, that will go and stuck into the dead spots, and then they'll start proliferating from there. So that's one of the reasons it should not be kept in dead spots. And the bend angle, it will not be like a PA shape. It will be like a U shape, so that it will not form a dead spots. So these are the major things that one has to take care on the specification of a WFI. The pyrogen content, the microbial content, that should be less than 10 colony forming unit per 100 ml. Your organic content, like total organic carbon, and your inorganic content like water conductivity, they will do. So that should be less than I think 1.3 microsiemens per centimeter. Air quality. So HEPA filters plays a major role in maintaining the air quality, right? So these HEPA filters are like around 0.3 micron. Mostly, it will reduce, say 99.97. It will reduce whatever you have in this. So this is an overview of classification, air classification. Like the warehouse is not a classified area, but your components and equipment preparation area, this comes under class B. Sorry, class C, this one. And filling and stopping area comes under class A. Okay. So clean room behavior. So what they do in clean room, I would say, like you can see the person who is just standing next to the filling machine, just lifted his arm like this and holding like this. The reason why they stand like this is, if they keep their arm like this and walk like this, it in turn may generate more particles. So that is another reason. And a person, like even if it is sitting, he should be sit like this. If he's standing, he should be standing like this slowly. All your operations inside the clean room, which is a class B area, that should be very, very slow, so that you should not shed more particles. And even walking, that will be happening very slowly. And you'll not have more than 1 or 2%. 2% is a maximum. Only 1% like they'll be operating and controlling the filling area. You'll not have more people to do this operation. You can see like how tough his life is. Nowadays in COVID, many of you have seen this uniform, like many people wearing. Take it from me, the life of a person who is there in the manufacturing plant, he used to do this every day in and day out. So they have got more expertise in wearing this than the recent COVID healthcare workers. So maybe these people should have been taken for training the workers to how to quickly don in and down out the gowns. Okay, this is a process, general process. I'll not spend much time on this. Okay, again, these are the same things what we discussed. Nothing specific we have. Just as a summary of how a manufacturing process will happen. Okay. Once you dispense a drug, there'll be compounding, and based upon the temperature, I've just given us an example of 2 to 8. It's not 2 to 8 exactly for every process. There'll be a filter, and then it'll be a holding vessel, and then it will be passed on to additional filters. And then finally, there'll be a filling and stoppering. The stopper will again be based upon the type of product we want to make, whether it is a partial stoppering for a lifeless product, and it can be a full stoppering for a product that can be terminally sterilized. Then it will be subjected either for lyo or thermalization based upon the requirement. So that's all in short, and these are some of the information about the drug product development. I think I'll not be able to cover this, but I'll just keep this as a part of your the presentation. So in case if a team needs, maybe we can have some session sometime later separately. So this is an overall timeline what it would take for developing an innovative medicine and a generic medicine. And these are all the other entities will be involved in making the drug product, and finally bringing this into the market. And there are some requirements I've just given below. And finally, yeah, thank you to the team for engaging and for giving this opportunity. I think we just got 2 minutes. Maybe I can take some questions quickly within this 2 minutes. Hello.
The student,
Yeah,
any
Balaji.
questions? Yeah. Balaji was very nice, very illustrative and very explained. Thank you. We will receive the PDF also, PD, not the YouTube. Yeah, thank you. Very interesting. Yeah.
Excuse me. I just have a request. Please do not put this in YouTube as of now. Maybe I can share the deck, and you can share that to the team for the students
PDF.
recommend. But let's not put this in YouTube. Yeah, I can share the PDF
Okay.
to you. No worries. I can share with you.
No problem.
No, please don't upload in the YouTube. Yeah.
Okay, because our thing was every week we used to have, but it doesn't matter. Thank you. PDF is sufficient, more than sufficient.
Yeah,
Thank
please. Thank you. Thank you. Thank you.
Thanks, Balaji. Maybe
I'll
we'll
just
come
stop
back to you
sharing.
again. Yeah.
Okay.
Maybe we'll come back to you again with another session for career opportunities for our students. in the
Oh, okay,
parental
great.
industry.
Yeah, great.
Let's do that sometime in a couple of months once they
Sure,
complete their
sure.
exams or whatever.
Sure.
So I think there are no other questions from the students as such.
Okay, great. So if that
Sir.
is the case, yeah, please go ahead. Yeah, there was a question.
Sir, I
There
have
was,
one question, sir. Is the
yeah.
limitations used in parentals for adult is the same that for infants and neonates, or it can be different, sir?
Well, when you say limitations, are you talking about the dose, or are you talking about
No,
the?
sir, not about the doses, sir. When we
Hmm.
go for waterfall injection, there should be the particle size range and inorganic content range. Is it same for the neonates and infants, sir? Or else,
Yes, mostly it will be the same because mostly it is the same. The only difference for the infants is we recently had a discussion with the doctors from Royal Society of Surgeons from Ireland. The thing what we understood was the volume of injections which an adult take and which an infant take is a big challenge, especially the infants with the neonatal ICU care in NICU. So that's one of the biggest challenge, one limitations there. Because of that, we are forced to make some products which are specific for infants. Otherwise, since again, as I said, the parental products are devoid of any living or viable or non-viable particles, I would say, just for a fair understanding. So since the parental drug product itself is devoid of this, the standards for this are usually same. But since there are some limitations on how a drug product can be given to an infant, the formulation would vary a bit. And not all the parental drug product which an adult can take can be given to the patient. I mean, the infant patient. And also the administration methodology will vary. Hello?
okay, sir. Okay, sir.
Did I answer you? Maybe just to give a little bit insight. For a infant, there was a baby which was just less than I would say 12 weeks. The maximum amount of a drug that can be, or the volume of a drug that can be given to the child in a day, or the infant in a day, is just 4 ml. Imagine in this 4 ml, you have to give the drugs. At least there was around 8 type of drugs that has to be administered to that infant. Over and above that, you have to also have to give a nutrition to that particular infant. Sorry, I said it was one day. It was not for one day, one administration. So in a day there can be 3 administration for the infant. So in that 4 ml, you have to bring in all these medications so that you can keep the baby stable. At the same time, you can treat the baby. So that's the biggest challenge with the infants. Yeah.
Thanks, Balaji.
Thank you, Balaji, so much. Thank you so much.
Yeah. Thank you all. I'll stop sharing the screen.
Yeah. Thank you so
Thanks
much.
a lot.
Thanks for your valuable time.
Great.
Okay, are you?
Sir, am I audible?
Yeah, you're audible, ma'am. No problem.
Welcome, ma'am. Welcome, ma'am.
Okay.
Yeah, thank you.
Yes. Good morning, ma'am.
Morning, ma'am. Morning. Welcome, ma'am.
Good morning,
Thanks
sir.
for your time. Please, ma'am.
I'll just give a brief about Dr. Karpagavalli before she starts her presentation. If that's okay? Hello? Hello? Hello.
Hello.
Can you hear me?
Yes, sir.
Okay. Let me introduce Dr. Karpagavalli. She has over 14 years of experience and she is currently working as a assistant professor in Jaya College of Pharmacy. She has completed a bachelor's degree and master's degree. She completed a master's in Chennai Madras Medical College, and she has done her PhD as well. So she has over 14 years of teaching experience. So I think that's a short profile about her. Ma'am, you can please go ahead with your presentation, ma'am.
Okay, sir. Thank you, sir.
You can try using your slide. If not, I can share it for you, ma'am.
Yes, sir. Yes, sir. I'll just try.
You can go ahead, ma'am.
Okay, sir. Thank you so much.
Yeah.
So good morning to all. I first feel immense pleasure to deliver this small topic. It's a small information regarding semi-solid dosage forms, from where you would get some important questions during your GPAT examinations, right? So good morning to all. So as you all know, semi-solids are usually they are used for topical applications. That is, they are mainly used for external applications. So they are products of semi-solid consistency applied to the skin or mucous membrane. They act both as therapeutic or as protective action, or also act as cosmetic function. So they are of two types. They are medicated, which contain the drugs which act as therapeutic agents, or they act as non-medicated. So where they are just going to act as protectants or emollients. That is, they are going to give moisturizing effect or protective soothing effects. So coming to the definitions, what are the basic definitions? As you all know, you have all studied, just a revision, it's a recap. So ointments or semi-solid preparations meant for external application to the skin or mucous membrane. So likewise, paste or also semi-solid preparations.
Ma'am, sorry to interrupt.
Yes, sir.
Our slides move on, ma'am. First slide clear.
I have given 1 second, sir. Sir, is it moving?
No, ma'am.
No.
Okay, if we are having problems, I'm sure. I cannot see the slides moving. Maybe if somebody else can respond, it will be better.
1 second, sir.
Now it's moving. Now.
Now it's moving. Is it okay, sir?
Yes, you're on semi-solid forms.
But now it's not moving.
It's in semi-solid dosage form.
Okay, sir. I
Okay,
gave
you can go ahead.
slideshow. The problem is with slideshow, I think. Now it's moving. Can you see?
Yes, ma'am. Maybe.
Okay.
Yes.
Okay, sir.
Okay.
So
If the
as I
students have any
told,
problems, please come up.
yes, you can
open up and
inform
let us
me.
know, please.
Dear students, you
Yeah.
can inform me if you're not audible or if you're not visible. So as
Yes,
I
ma'am.
told,
Please go ahead. Thanks.
semi-solid dosage, yes, sir, thank you, sir. Semi-solid dosage forms, as I told, they are semi-solids and they are used both for therapeutic action as well as protective action, and also used for cosmetic function like creams. So, as I told, they are medicated and non-medicated. So medicated means they have the drugs for giving protective action, that is therapeutic action, else they act as emollients. As I told, they are going to act as moisturizing agents. So as a recap on definitions, ointments are the most commonly used semi-solid preparations meant for therapeutic use, especially on the skin for topical applications. So comparatively, paste are also semi-solid preparations, but only difference is they contain high amount of solid ingredients. That is, they have nearly 50% or more of the solid ingredients present in the paste, right? So then creams are also semi-solid preparations, but they act as emulsions like oil in water or water in oil. And gels are semi-solid preparations, which will be transparent or translucent. So you have even jellies. So the general types of semi-solids include ointment, cream, paste, gels and jellies, and poultices. So poultices are nowadays rarely used because they had some deleterious effects. So the types of semi-solids, again, the definition I've given, they are translucent, viscous, solid preparations for external application to skin or mucous membrane, which are medicated or not. So mainly they'll be used as emollients or occlusives. So you all know what are emollients. They are going to act as moisturizing agents. Occlusives are mainly used to retain the moisture content. That is, if you're going to oversweat, the excess moisture will be lost, which is going to cause dryness on the skin. So that will be retained by the ointments as occlusives. So creams are of two types, water in oil or oil in water. So based on that, the type of emulsifying agents will be used. So as I told, paste will contain nearly high solid content, about 50% or more. So poultices are solid masses of solid matter to reduce inflammation and in some cases act as counter irritant. So they retain the heat for a considerable time on application. So where they're going to reduce the inflammation. The sound is
orientation
unmuted condition, so I'm getting the voice, sir. I couldn't take class.
Ma'am, wait, hang on, ma'am. Somebody is making a lot of noise. Premavati, I think, can you mute yourself, please?
Yes, thank you. The next
Yeah.
is gels and jellies. Comparatively, jellies are transparent and translucent than the ointments, paste, or creams. So they have a three-dimensional polymeric matrix structure due to some cross-linking of the polymers being used. They are used for medication, lubrication, and spermicidal actions. So coming to the first type of semi-solid dosage form, the ointments. So they are, especially as I told, they are used as therapeutic and cosmetic purposes or non-medicated ointments. So commonly we use the ophthalmic ointments and rectal ointments, so which are used for symptomatic relief against fissures, hemorrhoids, and pruritus, that is itching. So medicated ointments primarily consist of drug incorporated into a base. So types of ointment bases, these are much more important for your exam point of view. So they will ask much questions based on the types of ointment bases like oleaginous bases, also called as hydrocarbon bases. The second type is absorption basis. The third is emulsion basis, also called as water removal basis. And the fourth type is water soluble basis. So just it's a revision. What are the types? The oleaginous or hydrocarbon bases. As the name tells, oleaginous bases are nothing but oily bases. So they'll be waxy or greasy, and they're just because they're obtained from petroleum products, they're also called as hydrocarbon bases. The classical examples are hard paraffin, soft paraffin, and liquid paraffin. So hard paraffin, as the name says, they are solid saturated hydrocarbons derived from petroleum products, which are colorless or white wax-like solid materials. So the melting temperature of hard paraffin is between 47 and 65 degrees, and it is used to enhance the properties of ointment bases. Comparatively, soft paraffins or semi-solid hydrocarbons obtained from petroleum. There are two types as yellow soft paraffin and white soft paraffin. So one major difference, as we all know, that usually you should never use your white soft paraffin in preparation, that is ointments intended for use in ophthalmic, that is in eye or on broken skin, because that bleaching effect which we do to convert your yellow soft to white soft paraffin will give irritation effect. So you should avoid using that. Then the last third type is liquid paraffin, which is liquid hydrocarbon. So it will be white, transparent, oily liquid. So combining with hard or soft paraffin, it is used to just harden or soften the ointment base and also acts as a levigating agent, that is for mixing. Then the second type is absorption bases. As the name says, absorption bases, they are just used to incorporate small amount of water or aqueous solutions of the drug which are soluble in water to be incorporated into the ointment bases. So they do not absorb water on contact, but with sufficient mixing, that is agitation, they absorb small quantities of the water, that is aqueous solutions, and they form the water and oil type of emulsions. Comparative to hydrocarbon bases, they are less occlusive, that is they retain less moisture, but and they are not easily removable from the skin, and just mainly they are used for incorporating small amounts of aqueous soluble drugs in the aqueous solvent. So the types include wool fat, which is also called as anhydrous lanolin. It is obtained from the wool of sheep, Ovis aries. So maybe they will ask this question, from where we get this anhydrous lanolin, or what is the other name, wool fat. So likewise, wool alcohol, then beeswax and hydrous wool fat or the other types of absorption bases. So mainly beeswax is used as a stiffening agent in paste and ointments. So maybe that question also will come. So these are some advantages and disadvantages. The third type is water removable bases. So they are generally oil in water type of emulsions. So they resemble creams in appearance based on their consistency. So they have the ability to absorb water and serum discharges. So when we have broken skin wounds, so where we have the discharge of fluids from the open wounds or broken skin, so that secretions, body secretions will be absorbed by the ointments which we prepare using this water removable bases. So they can be diluted with water. So the examples include, so they're going to form water and oil type of emulsion, which are greasy, as the name implies. So oil is the continuous base, means the base, it's going to be greasy in nature. So it will be sticky. Example, your sulfur and zinc ointments. If it's going to be of oil in water type, they can be easily removed from the skin. Example is your vanishing cream. So as the name implies, something vanishing means it is easy to evaporate. So your vanishing cream will be of oil in water type. The last type is your water soluble bases. They are also called as greaseless base. So they do not contain oleaginous substance. Means what? As I told, oleaginous means oily substances will not be present in this type of base, and they contain completely water soluble ingredients. So examples include carbowaxes. Then if they are based upon their molecular weight, they can be liquids or solids. So then the pectin, trachagant and other cellulose derivatives, gelatin, bentonite, glycerin and all will act as water soluble bases. So they are the water greaseless bases. So example, carbowaxes are also called as polyethylene glycols or macrogols. They'll ask the question, what is the other name of carbowaxes? There it is called as macrogols. So they are mixtures of polycondensation products of ethylene oxide and water. So as I told, based on their molecular weight, they'll be in the form of viscous liquids or greasy semi-solids or waxy solids. So the properties of the macrogols. So just a revision, what are the types of ointment bases? Means oleaginous or hydrocarbon bases, absorption bases, then water emulsifiable bases and water soluble greaseless bases. So coming to the manufacturing methods of semi-solids, especially ointments, paste or creams, whatever, the common methods for ointments include the incorporation or trituration method, your fusion method, chemical reaction method and emulsification method. So incorporation method is involved for mixing the solids and liquids with the ointment base. So they will use either ointment tile and spatula, or they'll use even mortar and pestle, right, for mixing. So for lab purpose, they will use the ointment tile and spatula, else they prefer colloid mills likewise in industries. So just a simple steps involved, the method involves steps like size reduction. All the ingredients along with the medicament, we have to take it. We have to size reduce using mortar and pestle. Then we will add little amount of the levigating agent, any oil. Then remaining amount of the base will be mixed along with it. So we will get the ointment of fine consistency. So fusion method, simply fusion means melting. So when ointment base consists of many number of solid ingredients, and when their melting point differences are more, they are going to have wide range of melting point differences. So all the ingredients will be subjected to heat to melt. Then, and one more point, that melting will be done in decreasing order of range. Then heat sensitive or any volatile substances will be added at last to avoid their degradation or loss due to volatility. Then all the ingredients will be mixed by melting. Then finally on cooling, they will get the semi-solid consistency. Usually in lab scale, they'll use the porcelain dish or glass beaker, else they'll use steam jacketed kettle in large scale. Then emulsification method, fats, oils and waxes are melted together to a temperature of 70 degrees. Then aqueous solution of heat stable or water soluble compounds will also be heated to the same temperature. Then the third step is aqueous solution will be slowly added to the molten base with continuous stirring until cool. And then to maintain the stability of that emulsion, usually we will add the emulsifying agent. So water soluble soaps are commonly used as emulsifier for oil in water. Likewise, oil soluble, that is combination of triethanolamine stearate and fetal alcohol, will be used for oil in water emulsions. In case of water in oil, we use beeswax along with borax and all, especially in cold creams. So the fourth type, chemical reaction method, it involves chemical reactions. So we know that usually iodine ointment is going to give staining in the free form. So that when we are going, and it is only slightly soluble in the fats and vegetable oils, in that case, it is made readily soluble by using potassium iodide solution in water, so which leads to formation of polyiodides. So these polyiodides are readily soluble in water, alcohol or glycerin, and this is incorporated with the molten absorption ointment base. So that is ointment containing free iodine. And ointment containing combined iodine is used to remove the staining caused by the iodine present in the ointment. So where the iodine gets combined with the unsaturated fatty acids, so where it's not available to give that stain. So it leaves no stain when rubbed into the skin, so called as non-staining iodine ointment. So evaluation part of ointments. So they'll evaluate for drug content, the release rate, the penetration rate of the medicament into the skin, absorption of medicament into bloodstream, the consistency and irritant effect. So the parameters, drug content, they will select 10 filled containers. They will weigh the required amount of ointment. It will be extracted into a suitable solvent. So drug content will be determined by analytical techniques, by assays. And release rate is done by agar cup method or diffusion method. So as we all know, agar cup method is used to determine the release rate of antibacterial ointment. So where we are going to use a test organism like Staphylococcus aureus, and based on the zone of inhibition related to the bacterial growth, we can determine the antibacterial activity of the ointment. In diffusion method, it is used to find the release rate of any type of medicament from the base. So they will take a semi-permeable membrane tied at one end of glass tube. So it will be filled with the ointment through the other end and spread on the membrane. It will be dipped in the distilled water and to maintain the body temperature 37 degrees. And after some time, samples will be withdrawn at specified period of time. To maintain skin condition, it will be replaced with the fresh distilled water and it will be analyzed for the drug content. So penetration rate of medicament is determined by rubbing weight amount of the sample to the defined areas at a fixed time. Unabsorbed material will be removed and it will be weighed again. So difference in weight determines the total amount of drug penetrated into the skin. And absorption of medicament into bloodstream is done by in vivo methods, simply by assaying the drug content either in blood urine, feces, or tissues after rubbing defined amount of the sample under saturated conditions. So consistency of the preparation, usually in lab scale, it is done by this method using a slide of glass plate over which the pulley will be passed. So upon, we will place the ointment on the glass slide and another glass slide will be over embossed on it. So based on the weights, we will determine how much the consistency, ointment is having consistency. If we go for industrial scale, we can't do it for, do it in the same manner, so that they will use devices like a penetrometer to determine the consistency of semi-solids. Then irritant effect, so it should not give any allergic reactions. For that, they will use the rabbits or even human skins will be used for patch testing. So that irritant effect will be analyzed if it's going to cause any lesions on the cornea or iris or conjunctiva of the rabbits. Sometimes even rats are used, so where the ointments are injected to the thigh muscles or under abdominal skin. So after time intervals of 24, 48, 72 or 96 hours, the irritant effect will be determined by any skin lesions. So coming to the next type, the paste. So paste are again semi-solid preparations, and as I told, only difference, they'll have large amounts of finely powdered solid substance, that is 50% or more. So they are thicker and stiffer than ointments and less greasy, and because due to less amount of base. So how they will manufacture the paste? What are the ingredients present means the active pharmaceutical ingredient, that is your drug, along with the base, the absorbents, humectants. Humectants, usually they will use glycerin or polyols. Then the flavors and stabilizers. So what are the bases means? Hydrocarbon bases, examples of paraffin and liquid paraffin. As I told, they are got from petroleum products. Water miscible bases include glycerin, and water soluble bases include your polyethylene glycols, also called as macrogols. So absorbents are just added in paste to absorb the wound exudates and secretions. As I told, from the open wound, the body secretions will be oozing out. So that will be absorbed by your paste. So example includes zinc oxide paste and zinc oxide and light kaolin or starch. Humectant, as we know, it's just to retain the moisture content without drying the paste. It's going to maintain. Example, glycerin, sorbitol, and propylene glycol. So the gels and jellies, so they are aqueous colloidal systems of hydrated forms of insoluble medicaments. Comparatively, jellies are transparent or translucent, non-greasy semi-solids which contain more water than the gels. So they are transparent or translucent, non-greasy preparations consisting of small or large molecules in an aqueous vehicle. So they act as lubricating agents in surgical aids, as local anesthetics, as antiseptics, or as spermicidal in non-surgical purposes. So gels are obviously not suitable for water-insoluble drugs. So gels, again, active ingredients, we use local anesthetics as in the formulation as gels, antiseptics, and spermicides. So along with that, we are going to add various gelling agents. And for dispersing, we use the co-solvents, preservatives, and water. So examples of gelling agents, natural gelling agents, gum tragacanth, alginates, starch, pectin, gelatin. Semi-synthetic gelling agents include cellulose derivatives like your HPMC, sodium, CMC, etc., CMC. Synthetic gelling agents are carbomers or PVA. So usually gels are prepared by adding the thickening agent along with the dispersing agent. Then thickening agent is added to the aqueous solution in which the drug has to be dissolved. Then this is triturated in a mortar until a smooth product is obtained. So when colored drug is to be incorporated, glass mortar will be used just to see the uniform mixing. Then whole gum is preferred to powdered gum to get clear preparation of uniform consistency. Then remaining ingredients will be added with stirring. So jellies or semi-solid to thick viscous fluids. They are transparent and translucent, non-greasy, and mucilage type applied to skin or mucous membrane. So types, as I told, there can be medicated, lubricating, or miscellaneous. So medicated jelly is used on mucous membrane for lubrication or antiseptic. Then vasoconstrictor, example, ephedrine sulfate jelly. and as a contraceptive, phenyl mercuric nitrate is used. Lubricating jellies are used, which should be sterile when inserted into sterile regions of body like rectal thermometers, urinary bladders, cystoscopes, surgical gloves, and catheters. Miscellaneous jellies are used for patch testing, which are used as vehicle for allergens in allergy tests and in electrocardiography like ECG, so to reduce the electrical resistance between the patient's skin and electrode. So the last is poultices or cataplasms. So they are defined as wet masses of solid matter applied to the skin, which retain the heat for their fermentation actions. They help reducing the inflammation and as counter irritant, and were used to drain the infectious material from the diseased tissue. But now they are under outdated preparations. So after heating the preparation, it will be spread on the dressing and applied as hot as the patient bears the heat to the affected area, where it is going to act as an anti-inflammatory agent and counter irritant. So some model questions regarding your GPAT exams. So which one of the following is a transparent, translucent, non-greasy, semi-solid preparation for external use? Means the options include paste, cream, jellies, or ointments. So here the answer is jellies, because comparatively ointments only transparent, paste or having high percentage of solids, so that they'll be opaque. Comparatively creams also. So the answer will be jellies. So why glycerin is incorporated in vanishing cream means the answer is drying, because it's not going to give any lubrication effect, or it's not going to give whiteness or irritation. And as we all know that glycerin is a humectant, it is just going to prevent drying in the vanishing cream. Creams which spread easily and rapidly on the skin, that is, they are going to disappear on the skin, means the answer would be vanishing cream. As I already told, something vanishing cream means they are going to easily evaporate from the skin. So the other options, cold cream will give some oily fat layer on the skin, and the cleansing cream and massage creams are not going to, they also have oily base, so they are not going to give that rapid spreadability. Then spreadability of cold cream is increased by adding what agent like ozokerite or vegetable oil or isopropyl myristin or hard paraffin. So ozokerite is a binder or emulsion stabilizer. It's going to act as a viscosity increasing agent. It's a mineral wax. Then vegetable oils are used to increase hydrations in the cream, and your isopropyl myristate is actually a skin penetration agent. So for that reason, it's going to act as a easy spreading agent. It's going to increase the penetration to the skin. What are the absorption bases? Examples means, as we know, wool fat, wool alcohol, hydrous wool alcohol, wool fat, all comes under absorption basis. So petrolatum, which comes under hydrocarbon basis, is the odd man out. It's not going to act as an absorption base. Then identify water soluble ointment base from the following means. So as we all know, your soft paraffin, liquid paraffin, hard paraffin all comes under petroleum base, that is oleaginous or hydrocarbon bases. So carbowaxes, also called as macrogols, is example of water soluble ointment base, so which is a greaseless base. Which of the following is used to improve the skin permeability of the drug in ointment means, as I told, to increase the permeability of the semi-solids to the skin, because they are topically applied. Usually they will add penetration enhancers. So where your dimethyl sulfoxide, alcohol like ethanol, and also urea can be used. So the option would be all of these. Toothpaste, what are the evaluation parameters usually done means all of these will be done. So we know that the paste should spread properly at the site of application. It should have tube inertness, means what? They will cut open the tubes and just check it for any abrasiveness or any degradation. So if it's going to be this same, it's going to cause some degradation in the product. Then fluoride content is much more important in the paste, because fluorides, presence of fluorides is going to cause prevent the tooth decay. So usually fluoride content in toothpaste will be around 1000 to 1500 parts per million. So all of these would be the option for this question. Ointments are prepared by following methods, except means options are trituration method, fusion method, bottle method, and emulsification method. So we know that along with trituration, fusion, emulsification, chemical reaction method, the answer would be bottle method. So this is only used for preparation of emulsions. So here, this is the odd man out. Which of the following is related to compound benzoic acid ointment means? So we know that benzoic acid ointment is also called as, along with that we have the salicylic acid. So it is Whitefield ointment, also called as Whitefield ointment. So when benzoic acid has the property of antifungal activity, it also acts as a keratolytic. So the option is all of these. Consistency of semi-solid dosage form is measured by using which equipment? So as the options, pH meter is not used to measure consistency. It's only for pH, and viscometer to determine the viscosity. So coming to the other two options, consistometer or penetrometer. So usually consistometers are used to measure the consistency of food products like sauces, jams, jellies and all. So in industrial part for pharmacy field, penetrometer is the option where it is used for determining the consistency of semi-solid products. So where a cone will be dropped by gravity into the sample, that is ointment or something. So the distance, how much that cone is going to travel inside the sample as a whole will be measured. So which is going to be read as the consistency of the preparation. So other question, hydrous wool fat is also called as lanolin. So we know petrolatum is your paraffin basis and lignin is other option. So the answer is lanolin. Lazar's paste is nothing but zinc oxide paste with salicylic acid. So zinc oxide paste alone is not called so, and zinc oxide ointment will not be the option because the question is paste. So benzoic acid and salicylic acid ointment is nothing but your Whitefield ointment. So the option is zinc oxide paste with salicylic acid. Non-staining iodine ointment is prepared from fixed oils containing usually the double bonds, that is unsaturated fatty acid. So the answer is unsaturated fatty acids. Ointment bases must have the pH quite identical with skin secretions because we all know that interstitial pH will be greater than 7. So comparatively, the skin pH is nearly 5 or to 5.5. So the option would be 5.5. So else if the pH of the formulation is going to change, it will lead to some irritant effects. White soft paraffin is never used in ophthalmic ointments. So as I told, it will have the presence of bleaching agent, right? So that bleaching agent is going to some chlorides, which is going to cause irritant effect in the eye or on the broken skin. So paste contain dash percentage of soluble powdered substances. So usually it will be nearly 50% or more. So you can give the option as 50% rather than 5, 10 or 70. Following is a gelling agent, pectin, gelatin, sodium alginate, all comes under gelling agents along with tragacanth and all. So the option is all of these. What is the use of stearic acid in vanishing cream means? Actually increase in transparency or increasing the white shining, or it's used to maintain stiffness. So usually borax and all is used to increase the stiffness of the creams. Comparatively, transparency, we use some natural gelling agents. So here the option would be stearic acid is mainly used to increase the consistency of the cream. Beeswax borax cream is the synonym of cold cream, right? So vanishing creams are prepared using your oil in water soluble soaps, triethanolamine soaps. So the option would be cold cream in case of beeswax borax cream. Then zero gels are nothing but the gels from which the solvent has been evaporated. So the gels without solvent are called as zero gels. As the name tells, they are zero, means what? They are not going to have the presence of solvent. So the answer is gels without solvent. So coal tar ointment is which type of ointment means? It can be, is it a keratoplastic or keratolytic or antifungal? So usually keratoplastic agents are nothing but, so they are going to act as agents which will dissolve, they will shed down the dead cells or the oily, scaly skin surfaces. And keratolytic means even they are going to stop the further growth. They cause breakdown of the scaly layers of the skin, and they give protection. And moreover, coal tar is an antifungal agent. So the option would be all of these. So coal tar is going to be used as a keratolytic or keratoplastic as well as an antifungal agent. Trituration method is used for preparation of semi-solids, especially when the medicaments are insoluble in the base directly. Else we can go for fusion method. So medicaments which are insoluble in base, we go for trituration method. Which of the following bases are often referred as greaseless bases? Means, as we saw in the types of bases, usually the water removable bases, that is the fourth option, the macrogols are going to act as greaseless bases. Rest, the oleaginous or absorption bases, all will have the presence of oily content, that is they are going to have sticky nature. Miscellaneous jellies are used for patch testing, electrocardiography, or both A and B and none of the above. So as I told, they are used both in patch testing, electrocardiography. So the option would be both A and B. So these are some of the questions which will be asked related to the semi-solids, which are a minor part of your syllabus for your exams. So I think that you would find it useful for your exam point of view. Regarding this small topic, I've given some information. So you have any doubts? Hello, am I audible?
Yes, ma'am, you're audible.
So students, do you have any doubts?
I think they're okay. So far, I haven't seen any questions from them.
So it's only a small topic. So regarding that, for exam point of view, I've prepared some questions and I've given. So if you have any doubts, you can ask.
Okay, I think the students have gone quite probably they're okay with it. Okay, ma'am. If there are no questions, then we'd like to thank you for your time and for making this presentation for them.
Okay, so thank you so much. I also thank our college, Jaya College principal, Dr. T.K. Gopal, for giving me this opportunity to, deliver the PPT regarding the semi-solids for this coaching class. It's a small information which I would share with the students. And I also thank you all the PAA IPGA members for giving me this opportunity to give this class. Thank you all again.
Thank you, ma'am. Kannan sir, thank you. Soundarajan sir.
Thank you very much, sir. Thank you very much, sir.
All right. We'll see you again next week. Meenakshi ma'am, thanks a lot. Jay Kumari ma'am as well.